Welcome to the Carbonara for Congress podcast, where we address the real issues that affect the lives of people and families who live right here with us in South Florida.
I'm Michael Carbonara. Welcome to the show today. Today we're here with Dr. Nabeel Kouka, a friend of mine and also who I think is the greatest doctor I've ever met.
Thank you.
Dr. Kouka, I know you have a lot to say about healthcare in America and where we are with a lot of the issues with policies, and that really, I think we both think it disrupted the healthcare industry as a whole in America. But before getting that, can you give a little background? How did you start your career? How did you end up where you are here today?
So I went to medical school, and after that I did my residency concentrating on family medicine and neuromusculoskeletal. Neuromusculoskeletal basically checking and treating the whole body with manipulation and trying to avoid medicine as much as possible. With time, I became more concentrated on seeing what's the outcome and how the medicine in the United States actually becoming degraded rather than to get improvements. Outside the United States, everybody thinking the United States medicine is the best in the world, which I agree, but then the way how Medicare and other insurances, plus the pharmaceutical companies, becoming looking at their profit and ignoring the doctors, that got us lower and lower. So right now I'm practicing. After 10 years of taking Medicare patients, I decided enough is enough, and I actually left the Medicare, and I don't take any more insurances. I'm not alone. There is many doctors who've been leaving the insurance companies and working privately.
Well, we've seen a lot of that once Obamacare came in and really turned medicine and healthcare into more of customers rather than serving patients. I think there was a lot of that where the computers and the nurses were actually making the decisions more than the doctors.
Absolutely. That's what happened. The Affordable Care Act, what did, they concentrating more specifically on insurances rather than the patient. And that's why when I was taking insurances, I will have to cut my time with the patients, because they are not paying for performance, how the patient will get better or not. They were paying for how many patients you will see, how many codes you have to put, and basically ended up that it is non-sustainable. We all wanted better for the patients. Having shut down or shortening the time with the patient, the doctor doesn't have the time to look at the real problem. It's becoming like a drive-through.
Unfortunate, and that's what I hope to do in Congress is actually have policies addressing things that are subsidized, like the healthcare industry, to focus on the patients and not umbrella subsidies that just give blanket money to the insurance companies, the pharmaceutical companies. I know the Republicans are trying to propose some plans now for healthcare savings accounts, putting money back into the patients and the citizens' pockets so they can decide what kind of healthcare they want. And I think that's important because we need competition. When there's just a guaranteed revenue stream for these insurance companies and pharmaceutical companies, they're incentivized just to churn them out like this drive-through because they guarantee profits. And that's not capitalism. I mean, that's setting us up for failure. That's setting people up, setting students up to repeat that cycle and make it worse. And the more you subsidize it, the bigger the fraud, the bigger the drain on the working class that really is. So, I mean, you've seen the old way,
both sides.
The way.
Yeah.
So what would you do? Like, what would you say, what do we need to actually have proper health care and health insurance in this country?
Most important is to be patient-centered, meaning we have to care about the patient rather than the time to spend with the patient. Give the doctors freedom to be able to do what he needs to do, and not by dictated what the insurance and what the Medicare wants you to do. That's the whole situation, and empower the patient, I will say, because the patient is the bottom line. Ask 90% of the people in the United States, are you happy with your health care right now?
Yeah.
And
well,
they
a lot
will
of people
say no.
don't see it from your angle. They look at the cost and availability of quality health care. But I think if you look at the other side, it's the doctors that have a lot to say about this, and it's the up-and-coming students that are trying to find a career and a life for themselves. So I think it's a wider conversation than what we see in the news typically about these subsidies for Obamacare. It's actually a much bigger bureaucracy than people realize.
Absolutely, I agree 100%, because what we see, we need to convince these people who are hesitant to go to medical school, yes, medical school is good, and despite even the sacrifice that they will do, it's a noble profession. And taking it from a noble profession to a business, becoming, when we went to medical school, or I finished medical school in the Soviet Union, I didn't know that neurosurgery were paying much more than regular physician for internal medicine. They will, once you finish medical school, you will be asked what you want, and or you try to direct yourself where you want it, because the neurosurgeon in the Soviet Union was making as much as the internist. That's exactly 110 rubles, which is about $30 at that time. But here, I remember one student came or asking him, how are you doing and everything? What do you think? And he said, where to go? And he said, plastic surgeon, of course, doc. I said, why is that? He said, well, money, doc. I said, but you have to understand, you have to love something, and the money will follow. If you just going for medicine and plastic surgery, that's not medicine. That's, you go to the bank, make money better than to do medicine. The idea, what I'm trying to do, joke aside, really, the patients are suffering.
It needs to not just be, the subsidizing it is just going to make the problem worse. We need to go back and have real healthcare that's quality, that's accessible, that's not just a tax on everybody, and where it's patient-driven, like you said. I don't think, I think Obamacare has been a real drain on us. I mean, it's unaffordable for everybody, but we need to change it. And I think, bring in actual healers and doctors rather than people that are just prescribing pills to you and then move it on to the next person that's what I think most Americans want. They all know that it's a bad situation. They all think about how it used to be and how things were better with care across many things. But it really went downhill. And I remember reading how all the doctors were leaving and they want more and more nurses. And so the nurses really make the decisions, but they're the ones that punch in those codes when they see the patient, they make their rounds. And, it's really meant for a high transition patient. They only care about how many beds are filled up and how they get more people in the beds. So, I mean, what do you tell the doctors? I mean, just this is the way it is, and you have to really love helping people. But how do they help people if they only get 5 minutes with them?
We learned this, again, returning back to the coronavirus. A lot of doctors got in trouble because they were supposed to say one way everything.
Yeah.
So it's literally the lockdown for doctors during the coronavirus was meant for us as doctors to take care of the patients, but you cannot even think, because how many doctors I know being prosecuted because or lost their license because they were thinking. They did not follow the rules. And
was that a state or a federal thing that they were just
no, it was not all the time, but one hospital in Orlando, in California, or in Oregon, the other in New York, the third is. Those are small examples, but showing you that bureaucracy cannot. You take the person, send them to medical school, then send them another 4 years on residency and whatever, and then you tell them, okay, forget everything you learn, you have to follow our orders. That doesn't work.
So really the doctor's a representation of the bureaucracy, not actually taking care of the patient.
Absolutely. And that's what I saw during the coronavirus. Yes, maybe partially I agree with the hardship that the doctors went through, because literally we need to get out from that position. Now I don't accept it. I can give you an example. I have last year, I had a Medicare calling us, our office, and asking for 39 patients' records. Okay. So the 39 patients' records we sent. Then they send me back saying only 3 of them will get paid.
I just don't see how this works. How people have accepted a bureaucracy that just makes no sense. Nothing makes sense here.
But that's that's what required, overhaul for the Medicare and other insurance, because if
Do you
that
think
will
there's anything
continue...
positive there, Obamacare policies that could be carried over? Is there any positive effect that has brought to the American people?
I didn't see any, to be honest with you, because looking at it, regardless... Why they passed it? Because they were the majority. I'm sorry, I lived there. And when I saw it, I have to look at the patient coming with me. I have Obamacare. I said, okay, so I will spend with you an hour, then I will get from your insurance $20, and then by the end of the year, you have to pay a couple of $1,000 because you made a couple of thousand extra than what you expected. So that's not, it doesn't make sense at all. So give that money to the patient as subsidy, not to spend it in the bars or somewhere. Give it in only one condition, that this has to go to medical services. And the patient...
Well, this has been a big debate between Republicans and Democrats for a long time. Nobody seems to agree how to do it properly. I mean, there's Republican policies now they're putting up to replace Obamacare. I agree that it needs to be scrapped and something better needs to be in place. You can't keep throwing good money at something that's terrible for everyone. Like, what does a good policy look like? Because it seems to be like everybody needs coverage. We need to take care of people that can't take care of themselves. We need people who are actually working not to be overtaxed, so that at the end of the day they have money to afford the basic necessities of life, but also to be getting ahead. I mean, we can't be taxed to the point where we're just spinning our wheels in the rat race to survive.
Absolutely. Again, it has to be concentrated on the patients and the doctors, bypassing the insurances and bypassing pharmaceutical companies. Give the doctors, after all of these years studying and learning all kinds of stuff, you need to give them the benefit of the doubt that they know what they are doing.
If such policies passed, like what you're talking about, and I think that is part of what the Republican plan is, in addition to having cost transparency and procedures in advance, so you can actually pick and choose where you get procedures done, create some market competition. How would that then affect the education system? I mean, if there's something new, do the universities, the med schools have to change what they're doing? Do people have to make adjustments for a different policy?
I think medical school should be isolated from politics, which is not the case, because politics, I mean, not...
Well, the universities want to make their money. They want to get tuition.
Right. They want to bring the pizza, pharmaceutical company to bring the pizza for students, and give them a pen written their company's name, so later on they will remember, oh, I ate pizza from this medicine company production, I have to write them prescription. No, that doesn't work.
Yeah.
And despite the fact that, unfortunately, some of the congressmen, and it's open, it's not my idea, it's all over published, that, yes, they stop giving doctors the travel and all of that stuff and the incentives, but now they are giving bigger incentive to the congressman that will get some back money from the pharmaceutical company and protect them in the future.
I mean, what would you say to other doctors? And, right now we're in a position where I think that the healthcare policies are going to change. And we saw, that was a big position of why the Democrats shut down the government. They wanted to subsidize Obamacare even more by $1.5 trillion, even though of all the fraud and inefficiencies it has. So I think the writing's on the wall that we're going to have something new relatively soon. And I hope it's something, a replacement, not a changing the bad stuff that's already there. We need to restart fresh with a policy that works for everyone. Well, what would you say to people that are going to school or other doctors, knowing that this is going to be changing in the near future?
I hope that this change will be faster than anticipating, because we wanted all of this yesterday. And the only thing that I'm afraid of, the challenge from the medical associations. Medical association being, I'm sorry, I don't call myself Republican or Democrat, But when you look at the issue, 99% of the democracy, the associations are Democrats. So what's going on with that? The idea is they are literally doing what the Democratic Party wants, and when the Republican want to change anything, they're standing against them.
Well, that's why there is a choice. You can have quality, accessible healthcare for everybody, but you need common sense how you get there. You can't tax the whole country to the point where they have no money for food, so that everybody has these umbrella policies to cover things that your premium may or may not even be affordable.
Not only that, then what are you talking about the doctors? Then the doctors, what will happen to them, it's very interesting. When in the Soviet Union, if you are a surgeon and I'm a surgeon, I do 10 surgeries the week and you do only 1 or 2. By the end of the week, I will get the same payments like you. And there is no competition unless you really love that. So what is here, when you are giving everybody the same thing, which is literally the word of communism, then what will happen? People will be like, hey, I'm getting exactly the same amount. Why I have to work hard? That will get triple effect on the patients. Now you are giving Medicare the say, oh, everybody have Medicare. Why? Why? Not everybody is going to the hospital. Not everybody is sick. Not everybody. And then the Medicare or whatever.
It'll bankrupt the country.
It will bankrupt the country. And the patients, now we see it, and you probably saw it, a lot of patients, for even small things, they try to travel abroad. Why? Because abroad is much cheaper.
I mean, you've seen every spectrum how the medical system works. What advice would you give to patients how to take care of themselves or how to navigate in the current climate of the healthcare system? And what should the average person do if they're sick, or how should they maybe even think like, what can I do to not be sick where I have to rely on that broken system?
I mean, that's where alternative medicine is coming to the market, and that's why it has to be regulated and it has to be offered by the doctor. If he doesn't know, send to some doctors who knows. We are, as I said, first of all, we have to fix the system that the walk-through or drive-through system that we have, rather than, okay, give the patients half an hour at least, give them more. That's number one. Allowing the doctor to explain, allowing the patients it. I tell patients, whenever you go to a doctor beside me, take a piece of paper, write before you go there what you want to ask. So by the end, you will know that he answered number 1, 2, 3, whatever. But if you go there, you will forget. Most of the patients said, I forgot why I came. Because oh, next time. What next time? There will not be next time. I will be in the hospital dying.
Well, thank you so much, and I appreciate having the show, and thank you for all the work you've been doing for your career, and you've helped me and my family. So again, thank you.
I really appreciate, and I wish you the best. Thank you for inviting me. And if you notice from time to time, I'm a little bit overwhelming because I am really concerned about healthcare in the United States, and I hope you being there in the Congress will help spread the word that you learn it on yourself rather than getting paid by insurance companies and pharmaceutical companies.
Certainly, that's my aim to do.
Thank you very much.
Thank you so much.
Thank you.
Thanks for watching. We hope you enjoyed today's show. It's available on replay, so click the like and subscribe button and forward it around to your friends. Let them get involved too. Remember, to really make your voice heard, you need to vote. Click the link below or scan the QR code to request a vote-by-mail ballot. Your vote can really make a difference. Thanks again, everyone.